Thank you for your participation in our presentation, Preventing Prescription Opioid Misuse, Addressing Pain Management via Telemedicine. You have now learned the key differences between telemedicine and in-person care, how pain management may be affected by the global environment, screening for mental health when treating pain, what a virtual visit for pain might actually look like, the importance of resources to help strengthen patient accountability, and education. I want to leave you with some key points and some take-home messages. At this point, you have seen a typical telehealth pain visit from start to finish. And you know that telemedicine is medicine. It requires flexibility, creativity, and a focus on good communication. There are no clinical differences between a telemedicine visit and a face-to-face. The opioid epidemic continues to ravage our country. PAs, like us, are on the forefront of that fight. Overdose deaths have increased in almost every state during the first 8 months of 2020. While the full impact of this pandemic is still yet unknown, there is data being reported, and these numbers are incredibly alarming, but sadly unsurprising. Once the pandemic hit, however, all of the standard risk factors for drug use, depression, anxiety, all were made much worse. People who were already struggling with substance use disorder found themselves unable to even attend group rehabilitation like AA or NA. In some cases, they weren't able to even attend their regular medical visits. With many patients experiencing worsening mental health, providers across specialties absolutely need to be prepared to address mental health issues more directly than maybe they ever have done in the past. And telehealth is going to be an important part of this solution. Screening your patients is going to be extremely important. SIGI caps, you probably recognize that from PA school. We actually use this to bring to mind the symptoms to help with diagnosis of depression. It is crucial that you know your resources. Are there specialists in your practice that actually can assist you? Make sure you're aware of alternatives to prescribing opioids, maybe like prescribing physical therapy or NSAIDs, and confirm that your patient can actually access the care that you prescribe. If you're feeling intimidated about the prospect of treating pain through telemedicine, I'm here to tell you that it can be done as well as an in-person office visit. Be sure and check out the additional resources for more in-depth information on this topic. Telemedicine can be a vital tool in the fight against prescription opioid misuse. By learning how to best provide care through all available mediums, you are helping to expand access to vulnerable populations and reduce the stigma associated with pain and pain management.